have anybody sign up for public comment. So we'll go on to the agenda items. Number 4, discussion and possible action. So discussion of letter in support of Attic Correctional Services. So if you remember last meeting, Sean was here giving a presentation, and we talked about a motion to support the Attic Correctional Services. And we couldn't do it last meeting because we didn't have it agendized as possible action. So has everybody had a chance to take a look at that in the packet? Okay. So we can actually take that action today if somebody wants to make a motion. Motion by Supervisor Conway. We have a second by Diane. Thank you. Any discussion on the letter of support for Attic?
It's just designed for one letter from all of us, or it's designed for most of us. Oh, the I, my all.
Yeah, I think it's, and I think we already passed it at the county level at the last meeting in support of Attic.
Change that. Okay,
Yeah.
so it's as
Yep, as a group. Yep. Any other discussion? All right, all in favor? Opposed? The ayes have it. Thank you. Next on the agenda is discussion of the final report progress. And if I could, take a look at the monitor up there or in your packet if you printed it out. The city, I would like to run through this with the folks that developed those slides to speak to those slides if we could. So I don't know, Becky or Terry, I know Matt's not here, but can you speak to these?
I think so.
Okay. Give you this.
Okay,
So I'd like to go like the history
Right.
first and then what the task force did after that.
okay. Can we just move the slides along? There. So the city has been working with the unhoused situation for quite a long time. There's always been members of the community who are unhoused. It started off the Salvation Army was the main purveyor of shelter capacity and help for unhoused. But then that did not meet demand. So, it wasn't that many years ago that we did not observe people sleeping outside, living outdoors, encampments. Even in 2014, 2015, I don't remember a lot. There may have been here and there. And now it has progressed to where in the last year or so, that is the mainstream. So because of those issues, the city council started working towards some kind of solution base due to the fact of different issues going on with people living outdoors.
Just say next
Go
slide.
next slide. So around 2012 to 2013, and that is when this is observed changes in Marathon County / Wausau homeless situation, policy decisions made by the city of Wausau, and then the delivery of the services. Next slide. So, as we said before, there was a relatively small population served by the Salvation Army who managed to run a homeless shelter on the west side. Again, just like I said, extremely rare to find individuals living in encampments or outdoors. Go ahead. This is some of the encampment pictures of what was normal, I would say 2 years ago. And it under bridges, the main places we had problems, the encampments were under bridges, especially along the river in that area. We also, in the last year or so, have seen encampments in along the Wisconsin River, north side of town by the park there, and hidden. And they try to hide and found by boats. As people were launching their boats in the 6th Street boat landing, we started getting calls of encampments there. So in 2013, Catholic Charities started the Warming Center, providing overnight shelter, laundry service, and meals to individuals without shelter during our winter months from November through April. This is starting to be ramping up. This is the 400 block. We had quite a bit of complaints, again, downtown, and of families. We have put a lot of money in the 400 block to make it a place, a destination place with concerts or with other, there's other nonprofits that have events there. And this is what was starting to happen, a lot of day drinking and people passing out, which was or urinating along into the pavilion during the day, and you can see children are present. So I was here for this in July 6, 2016. We passed the ordinance limiting the consumption and possession of alcohol on the 400 block to after 4 p.m. That did help the reduction of alcohol-related issues on that park. Then that seemed to move it to the Big Bull Falls Park, or what we call, the pavilion over there. The 400 block did have a lot less issues with right downtown. So the other problem in 2017 to 2019 was the unhoused population sheltering in the stairwells of Wausau parking ramp. And I remember Chief Bliven coming to the council saying this was just an untenable situation. There was a lot of cleanup that needed to be done every morning. DPW would go in there 4 or 5, try to clean up the waste products that were left there. There were people having sex in the stairwells for people walking, and we got a lot of complaints for people that were parking there that worked downtown. It was a scary situation, and again, it was a place where people shouldn't inhabit, right? That's not a healthy situation for unhoused either, trying to stay alive and warm in a parking ramp. So in November of 2019, there was an ordinance passed restricting trespassing or loitering in the parking ramps, and the police enforced this ordinance. And I want to be very clear. When we passed this ordinance, what it did allow was for the police to go, do you need a place to stay? Where can we take you? If there isn't an ordinance, they're just there. They could then intervene, and that is what the council asked. We don't want you just handing out tickets or ripping people and saying, go take a walk somewhere. We want them to find some place that people should inhabit. So that's what that ordinance was meant to do. 2016 to 25. Significant increase in encampments and individuals sleeping outside, again, under the bridges, parks. And I think a lot of neighborhoods are involved. I know I'm from the northeast side. Forest Park has people. The other park along the river has encampments. There's a lot of issues with encampments. First of all, people are inhabiting where they should not live, where humans should not live. Number 2, due to the encampments, there's violence a lot of times in these encampments between each other. On a logistic scale, when DPW goes to clean out, it takes, I can't even tell you how many tons of dump trucks to move out the articles that are there. There's needles, drug use. It's just not a good situation. And again, people shouldn't be inhabiting where people aren't supposed to be inhabiting. Go ahead. So that is kind of where we were at. We were at a precipice in the city with these encampments. Much of what like we heard in with La Crosse, public outcry, downtown businesses, public outcry about people scared to go Along that, what we have paid a lot of money to make that river walk well, people with families scared to walk there due to the encampments. All of this. So the city of Wausau created and funded a community outreach specialist, which is Tracy. Primary function of working with individuals experiencing homelessness, assisting them with resources and secure, stable housing. She is supervised by the Wausau Police Department. And again, I know that is a sticking point for some. We have no other department. We do not in the city of Wausau have a social service department. And there was no other department that it fit due to working with the unhoused population. It fit with the police because she can, it's a quick call back and forth. If there's a situation she needs help with, the police are there, they're understanding, and they work with the unhoused. So it does work pretty well. That's the same time we used ARPA money and decided 365 shelter. Catholic Charities who already provided. The shelter was contracted to continue to provide their shelter services and then open a day shelter. What started the day shelter again was council wanted to relieve pressure off of some of the downtown businesses and the library. The library, I have had complaints from for many years of people calling me, my residents stating, we're scared to use that right now. So that's not helping just dispersing people out. The council thought was, let's get a day shelter. And our thought on a day shelter was, let's get them connected to services. We don't want to just shelter people at night. Let's get them where we can find out how can we help you further. Didn't work. You know, it's a work in progress, but that was our thought process. So this was another very long discussion in October of 2022 about the park department rules regarding camping and the hours of operation. So again, this was not all city of Wausau. I mean, Marathon Park is a county park, right? They had rules on camping and the police decided we're going, and this is a good way to look at timing. We now offered 365 shelter. So now was a time when we could say, okay, we don't want you camping here, but we have a place for you to go. Before we offered 365 shelter, we didn't feel comfortable in saying, walk down the street. We had to find a place. So that's the reason of the timing for that. March of 2023, this was starting in October, then in March, the police department, along with the county parks department and DPW, established a 14-day process and procedure for notifying, posting, and removal of encampments. Items of value are removed, stored, and available for retrieval. And there's like one of the postings. We did follow the law. We had the city attorney's office in on this, on how to do it legally to try to limit the encampments. So the police department in March of 2023 started regular enforcement of camping rules and partners in regularly removal of encampments. And there's some of the pictures of what's left over. 2024, as we all know, Salvation Army stopped serving individuals in their shelter and pivoted to serving families with children, which is another need, but it did not help, you know, with having less shelter space for single people. April 2024, we approved accepting outside funding and self-funds for 2 additional officers. This again, as I talked about, addresses the quality of life issues in the downtown, the parks, library, and businesses. We had outcries from them that there were issues and it was causing strain on businesses. It was causing, again, strains in the library. So again, we're not looking at only enforcement here. We're looking at how can we connect people to services. So this has been, and I will let Chief Barnes pick up, but this is 2 officers that were outside funded by foundations that walk the beat downtown, and they connect people directly to services, get to know people, build relationships, and connect them to services, building trust. And this has been very successful, correct?
Yeah, I think by all accounts, they're doing what we asked them to do, which is a very difficult task. And was recognized to us, the challenges as they started doing their work. We want them to enforce the standards of our community, our ordinances, our state laws, while also partnering and shepherding those individuals to resources. And not everyone that potentially gets arrested for breaking a law or is held accountable is easy to partner with. But what we have seen directly through their work and their partnership with the different resources, including the Marathon County DA's office with their deflection and diversion programs, that in my opinion have been incredibly successful for certain individuals. And so the use of our officers in feeding the diversion and deflection program in order to get those individuals to sometimes the only way to get them into rehabilitation centers and to get them to be motivated to voluntarily go to these is that partnership between our officers, diversion and deflection, as well as other resources. So, so far we're a year into those individuals being in place, and based on the feedback I get from downtown businesses, people that use our downtown, as well as some of our in-house population, I think it has exceeded expectations.
You want me to go or you want to finish?
Sorry, first off, let me apologize for being late. Sometimes in the police department, things get in the way, and that would be today. So right at the end of last year, the city had to make its final decisions on allocating its ARPA funds, and a last minute decision was made to allocate, without specific projects and who to fund, the only way to allocate those ARPA funds by the end of the year, which I think it was actually December 30th when that resolution was passed, is to allocate them to an organization with to provide services that fell into the ARPA categories, which are pretty broad. And so those funds were allocated to the police department and our community outreach specialists to be able to spend dollars. In this case, it was up to $400,000 for night shelter, day shelter, transportation, case management. I think there's one other thing I'm missing that was listed, all in service of the homeless population. So that's where we went into 2025, and I prioritized on our behalf securing night shelter services and having that be secure and sustainable in our community, at least for the 2 years that this funding is available for, was our number one priority. And that RFP process closes Friday at 4:00. And then depending on whether there's funds left over after that, then it's establishing what the next priority is that those funds can be utilized for and starting that process all over again. I mean, I could speak for the county because I'm super excited about it, but through work and leadership from Chair Cavelli, they were gracious enough to give me the opportunity to talk to him, and working with Lance Leonard, the county authorized, like in essence, a match to the city using, I think, reserve funds is what they ultimately, the funds that they used. So for sorry, my hearing aids just died. For 2025, that's $200,000. And then Administrator Leonard was directed to use the county budget process at the end of the year to be able to do that again for 2026. I think some of the expectations of different elected or organizations that are run by elected officials representing the public is what their long-term expectations are. And I think it was very clear direction from the county board that we recognize the need for shelter services. We want there to be 365 shelter, but we also don't want to be in the funding of shelter services indefinitely. At least that was a takeaway that I got from them. So most recently, the Parks Department brought forward some changes to park ordinance. And what this was is taking park rules and the counties, because we have a city county Parks Department. And instead of having, here are the city rules for their parks and here are the county rules for their parks, to be able to align the rules that govern the county parks and the city parks. And at one point, there was a question of like, well, what is the ordinance that says there's no camping in our parks? And there are ordinances against what time do the parks close, what time can't you be in it? We have an ordinance that says the parks director gets to establish rules for the parks, and the ordinance is the enforcement of those rules. One of the rules was no camping in the parks. And what this ultimately did is align the city with the county in saying we have specific ordinance language regarding that. And so I think that with what we look for and what we're talking about with the unhoused community in this task force, it's important to understand like, well, what are those rules and how are they established and where did they come from? This was my 2 cents at the end here, which is basically like, we haven't solved homelessness. I don't know that we're going to solve homelessness. I think that the quality of life issues impacting our community have been positively impacted by policy decisions and ordinances that have been put in place. And we've helped a lot of people, but I will always stop short of saying, hey, look, there's even the finish line. We can see it. I think we're a long ways from that. And I would just share with whoever's watching this that a message that I share with my own staff is like, I still believe it's doable. Like, I do not believe we have reached a point of no return in addressing these and trying to find solutions to these problems. So I'm still optimistic that we're going to move the needle in the right direction.
Any questions on the history and the timeline? Comments? If not, if we could move to the next presentation. So here's the draft that I had developed over the last couple of weeks. And looking at, how do we present this to the full board and to the city council? So the first thing was listing our mission statement based on our charter. It's listed here, as you can see, and you can read it in the charter as well, listing all the stakeholders up there on the task force. So go ahead and go to the next slide. So, and what I'd like to do is have the group as listed up there present the information that's in the slides. So, Bill, if you could talk to this one.
Okay, so being able to find out how many we are and who they are. We don't have a great way to track it. There are elements that do. There's HMIS, there's Clarity, the shelter tracks things, Balance of State tracks things, but they do migration reports. There's obviously, the police records, things like that, but knowing how many and where are the tricky bits. So first, defining what it meant, which you went through, and then we don't have yet everyone has a name database, which is going to be a recommendation. That will allow us to a countdown for start and plenty more things connecting people to services before that, but the, what else do we have on that? Yeah, so the people that are unhoused are not just the ones that are at the shelter, they're also at Bridge Street, they're also, car camping, couch surfing, all those folks. So through the course of a year, I think we had almost 400 through the Clarity system, easily 200 on any given Sunday, so.
Okay, thank you. And, it's just, I think this slide is important just to outline what does it mean to be unhoused and what it looks like for Marathon County. So thank you, Bill, for doing that. Next slide, please. So the data that we reviewed in one of our first meetings is at this link for folks to click on. Hopefully it works, but you don't have to do it today. And if you could test it out on your computers to see if it works, and that would be great. Let's go ahead and go to the next slide. So this is some data I think Diane had provided, if I'm not mistaken, one of our early meetings. So if you want to talk through this data,
So this just shows,
do you want to do the microphone?
I always think that I'm talking loud enough. So this just shows those of us who use Clarity, which is an HMIS database, and those of us who are funded by Decker and HUD have to use this for every person that we serve. So that would be the Salvation Army, they're required to use it. Catholic Charities is required to use it. Obviously, you're not, because you don't get any of that funding. My agency uses it. Let's see, the women's community uses HMIS, which is, they have the private part of Clarity, or it's OSNIM, it's a separate database where no one else can see that data. So this just shows what we've seen as far as those being sheltered. Now, obviously, it doesn't count the people that don't seek shelter. It doesn't count the people that are, car camping, if they're not entered. I mean, like my staff go out this past week when Tara at the CPC was gone. I told her that we would try and connect with some new folks that we were seeing at the CPC, and this, so we try and capture that. We have them complete just a client registration form so that we can enter that data into Clarity. And we do that so that we can track. So I feel pretty comfortable that those numbers are accurate. But again, it's not going to count the people that we don't know about, those who are in the woods camping, if that's still occurring. And our definition doesn't allow us to count those who are doubling up in homes. That isn't always a good thing, but I'll just tell you this, it's not always a bad thing either. I do talk to some parents who are taking care of kids who live with them, and they are getting good guidance. Sometimes it's okay when a friend lives with another friend, if they too have good parents. I'll just say that, it's not ideal, but sometimes it isn't terrible if they have a good role model to follow, if their parents aren't, in serving in that capacity. I'll just say that.
So can you tell us the area that this data was collected from as far as the surrounding areas at Marathon County? Is it more than Marathon County, or is it just City of Wausau, or?
I believe that this is just Marathon County. So, and when you say the City of Wausau, that's where our shelters are. So this isn't including Lincoln County, which we serve, and it's not including Wood County. These are just for Marathon County.
Okay. And I think that's important to portray to the county board and the city council that these numbers are Marathon County.
Yes.
It's our area, right?
Yes,
Okay.
and you aren't seeing any of the data from domestic violence shelters either, because while we do collect their data every single month, we don't share that data.
Okay.
So those numbers aren't there, but it's roughly 16 to 20 a month
Okay.
for domestic violence.
Okay. That's a lot of people.
It is a lot of people. It didn't used to be like that. So
Okay.
there's a lot more to say, but
Yep.
this is probably not the place to say it.
Okay. Next slide. So it indicates that the available shelter space in our community is insufficient to accommodate the number of unsheltered individuals, correct?
Mhm.
Consequently, many unhoused individuals are turned away nightly, if that's still correct.
That is still correct.
Okay, and leaving them with no viable shelter options. So, and you'll see the graph below illustrates the number of individuals turned away from Catholic Charities each month from January 23 through October 2024 due to lack of shelter capacity. Data from the Salvation Army is excluded from this analysis because their turnaway statistics are not solely based on capacity constraints. They also consider factors such as criminal background and shelter supervisor discretion.
Yes.
So-
They are not a no barrier shelter like Catholic Charities, and they never have been.
Okay, next slide, please. So here's the data for the turnaways, monthly capacity versus turnaways. Do you want to speak to that one, Diane?
Well, I think it's pretty self-explanatory. So, the turnaways, I don't exactly know why there's always so many turnaways if they have the capacity to go up to 40. I mean, I don't know why they don't consistently go to 40. And I've never gotten an answer on that. I know that sounds naive, but I just don't understand if they can go to capacity, why they don't.
Mhm.
But I feel like there's more going on.
I'll chime in a little bit on that, which is my understanding, which I haven't asked that question of our city like inspections or zoning department, that the space they have is licensed or approved for 30 with emergency overflow up to 40, utilizing their hallways and other space. And so Catholic Charities established when determining like what is our capacity here with the fire department does that with buildings that are going to house people as well as our inspections. And they were comfortable given the parameters that Catholic Charities established. And I want to say it's 10 degrees above zero is the cutoff for them to expand capacity up to 40. And I don't.
It's bizarre. I'm sorry. I think that's bizarre when they have the space. And it's okay to do it when it's 10 degrees. It's okay to go above the fire hazard or whatever, but not every other day.
Yeah, and I think the point I just want to make is I don't know that it would be appropriate to be like that's a policy decision of Catholic Charities. I think there's a lot more factors to it as in regards to number of square feet and the appropriate uses of it. But I remember being part of that conversation many years ago, and there's only so much space in my chalkboard, so that was wiped clean.
I understand.
But I think that when we look at capacity, one of the questions that the public or any policymakers want to know is, how many people are we talking about? And so there's lots of different ways to measure them. And the one that was most impactful to me was during our most recent cold snap when Community on Call was activated. And so if you take the number of, and we took, myself included, went out all night long and walked in the islands and flashlights and looked in every nook and cranny we could find of that is known to us as a place people may be. And we found no one, which made sense to us because it was like 20 degrees below zero and I was miserable and so was everyone else. So when we looked at the numbers from how many people were taken to Community on Call and how many were in shelter, like I acknowledge there might be people in a car somewhere, or there might be people who have family who are like, it's so cold outside, why don't you come here? But we were consistently in that 52 to 55 range for a number of people that were housed at Catholic Charities plus who were being sheltered in Community on Call. So like if someone were to say to me, how many people would be sleeping outside tonight if not for shelter services, like that's my number that I use. And that seems to help people wrap their head around it. And then additionally providing them, but it doesn't count these things that exist. And so I think one of the things that's been a takeaway in looking at this, like, what is your definition of homelessness? And we talked about that. And then there's still a whole nother population of, you don't meet a definition of homelessness, but you are clearly on the bubble and at risk of homelessness if for some life-changing event or something bad happens. So, I mean, that's the way I've shared, like, many people are like, well, tell me about home. I'm like, well, which part do you want to know? And really, they want to know how many people would be sleeping outside.
Right, and there are so many varying degrees of almost homelessness, and that's what my agency is most, I guess, useful at addressing, because we don't want homelessness to happen, because once people become homeless, that is when everything falls downhill, especially families. And I think that was one of the mitigating factors as to why the Salvation Army went to serving families. But I would agree with you. I would say there's about 50 every night that are homeless. But in the summertime, a lot of people will choose not to use shelter because they would prefer. There's a lot of people who would prefer not to follow the rules and to be outside in their element, in their environment that they want to be in. And it's, of course, easier to do that in a warmer climate. So, yeah.
I think there were also a lot of that don't allow people to do.
So if you could use a microphone. Thank you.
I believe there are a lot of unhoused individuals whose mental illnesses don't allow them to be in shelters because they just can't tolerate the group proximity. So that probably accounts for some of that as well.
Oh, I would agree. There's a lot of vulnerable people out there, and I think we need to really work on serving those people.
Another unintended kind of positive consequence of housing people that are unhoused, I've noticed with the folks that we've housed, they kind of congregate too. So if we could find someone housing, they'll call their friend who is also unhoused and they'll stay with them. Okay, so that kind of is a two birds with one stone, as long as landlords don't get cranky about that.
And that's the problem, landlords do.
I'll challenge you a little bit on that. Like, yes, it can provide shelter for the friends that are invited over, but at least from the building relationships with landlords and asking them to rent to individuals that maybe have a poor rental history or a criminal background. When there's trust built and they agree to do that, and the rules are like, this is for you, not you and your 10 friends to be here, and then those rules are violated, it makes it even more difficult. One, they're evicted from that process and they're back to square one. And then two, it makes it harder for those individuals trying to build those relationships with those landlords. It makes it harder to go back to them and be like, okay, like, I know it didn't work in this case, but can we try it again here? I think we've seen people that have a roof over their head at night, net positive, but in the big picture of moving everything forward, I would say that relationship component and Come Stay at Our House has been more of a negative than a positive, like through our lens.
Can I just clarify the capacity numbers? So it's 15 degrees that they activate overflow. And then the space they use for overflow is the dining room and hallways, not the dormitory. If that helps clarify that question. Yep. Okay, thank you. Next slide, please. So it's noted that the daily shelter return away from Catholic Charities was not collected until May 2024, correct? Okay, then detailed turn away figures for each day are included in the graphs provided on subsequent pages of this report. Additionally, Catholic Charities supplied employment statistics for September 2024, offering further insight into economic challenges faced by the unhoused population. Next slide, please. So Dana, if you could talk to a little bit about this.
Can we just go back to the previous slide real quick? Because I think it's incredibly important to recognize, like the next one after that, sorry, that has to do with employment data. I, for one, was very surprised when looking at the employment data of those individuals utilizing shelter at Catholic Charities. I think the average citizen says, why don't they go get a job? And the fact that I would say currently today, I haven't looked at any statistics for this month, but for last month, the majority of the people staying in shelter were employed. And that employment still didn't allow them, with all the other circumstances, life circumstances they've dealt with, didn't provide them enough dollars to be able to go become housed. It is a step in the right direction. I'm very pleased and proud of those individuals that are doing that, but that makes it harder. And then Catholic Charities has a policy that rewards those individuals utilizing shelter with, if you are employed, your shelter opportunity tonight is guaranteed. And so for those individuals that aren't employed, that reduces the capacity of shelter. Like, do you think I'm explaining that well enough? Okay.
Yeah, that's a good point. I think we can talk to that during that slide too. I think that's a great point.
Yeah, and I think it's a very good thing. And that's why it's so critical when those people are in shelter that somebody enrolls them in coordinated entry, because they can come up on a housing list and we can get them housed, pay for their rent for a little while because they are working, and advocate with the landlord and get them housed. And then they'll probably stay housed because they're continuing to work. But when people aren't entered in coordinated entry, they can't get in TBRE, they can't get in prevention, they can't get in rapid rehousing. Because we're not allowed to do that unless they're on this list. So, and the by name ROI is in place, by the way.
Sure. Thank you. I had Craig and Diane on this slide, so if you want to speak to this.
Sure. First of all, I don't know if I can, as I read through this, if I can make a suggestion. But we had put in a summary in the slide and then revision the detail that are in the later slides being maybe in a link to another document, just so the slides don't become so overwhelming.
Sure.
So what you're seeing here first is slides that Diane put together after our meeting, and we have it broken down. These are the faith-based nonprofits that are serving, and then these are the non-faith nonprofits that are directly serving the unhoused population. And we just put some bullet points, but then your later slides get into all the details. And my suggestion would be to not put all those details in the slide. That's just a lot to work.
Well, some of those slides, if you notice, were hidden from the
They
presentation.
were. I guess I didn't
so
understand that.
The ones that were
Excellent.
grayed out are
Okay.
hidden slides,
All right,
so
good.
they don't typically will pop
excellent.
up on there.
Good.
So-
Okay. Could we put maybe like a link?
Yep.
That to a document and have the document loaded up. So that describes it in more detail. But so basically we identified 5 area nonprofits that were faith-based, that were specifically serving the unhoused population. That would be Bridge Street Mission, that has our outreach center, which is really a day center, although it's not funded by the city, but it is still a day center, and it's a meal service for anyone who's hungry, even if they're not homeless. Then we have our Men's Recovery Center, which is a program shelter, and then we have plans to do the future Women's Recovery Center. Catholic Charities has the Good Shepherd Shelter that we speak about a lot already here, and we know they're going back now to the model of November through April. But they also have some other programs like Beyond Shelter, that is a housing first model. On the next slide, you see the Salvation Army that Larry's mentioned, that they've gone to the family shelter. It's 3 families, but they also serve the unhoused community through their community lunch. So that kind of becomes at least a partial day center as well. The Hager House is working with specifically women in crisis that have children, and they have housing and programming for them. And then Gospel TLC is located out in Weston, but they have pretty much it's a recovery center for about 14 men, but it's very programmed, again, specifically focusing on people who have addiction issues. And then we just kind of repeated that same pattern that we did on the faith-based with the non-faith-based. And I'll let Diane walk through those. You can go to the next slide. But I do want to make a point that we've left out Northern Valley Industries. And so Bill is committed to sending us a paragraph that we can add to that document, and then we can add to the slide. So Diane, do you want to go from here?
Sure. I put our organization first because I'm most familiar with it, of course. So we only have one program that serves the unhoused, and that's our permanent supportive housing. It is not permanent housing forever. It is just a longer housing program. We like to say 1 to 3 years, although we've had people in it up to 5 years now. And generally, these people are they have a disabling condition of some sort, whether it meant mental health or addiction, or a regular physical disability. So that's our PSH program. The women's community, they only help people who are victims of domestic violence or sex trafficking or human trafficking, I believe. I don't get a lot of data from them because of the confidentiality that they require. The Marty bus, I'm not real familiar with, although I did meet somebody at the Grand last night and she's gonna meet with me. I have tried to meet with the gal who used to run it. I can't remember her name. Sandy. But she didn't like our agency too much. And now she's not, I think, with the Marty bus. I'm not sure, maybe in a volunteer capacity. But this gal seemed really wanting to learn about stuff that everybody does. So I think that's a good step. No, it was somebody else, somebody who volunteers. But you know, she has a heart of gold, it seems. So anyways, I'm looking forward to speaking with her.
We're kicking Diane with Marty Bus. They are very much in touch on the outside with people who are experiencing the homelessness, the ones that are probably in camping and things like that. And so they have it twice a week. They do a meal that's all volunteer led, and they have many that come out to their bus and eat. And beyond that meal, though, they're giving them supplies, safety, and they actually have some volunteers within their organization that have actually helped set people up with furniture, like in an apartment and things like that. And then they're right now on an initiative where they're trying to locate locations where they can put lockers so that the homeless have a safe, secure place to put their things.
When we were talking about the number of unhoused, I know that the Marty bus serves 60 to 65 of the unhoused probably twice a week. So I guess I question where the number of 50 to 60 comes in. Probably, you know, I just don't know how accurate that number is, if there are a lot more than that or.
Well, I can tell you that a lot of our so we have 10 people in PSH in our program. While they're considered homeless, they're really not homeless right now because they are in a program, they are housed. They most definitely go to the Marty bus for things. They'll go anywhere for things. I mean, and you know, that's if there are items available that they want that they can sell. I mean, some of our clients, I know that's what they do. They'll go there and get them, unfortunately. So they could be taking away from somebody who really needs that item, you know, that they get from the Marty bus. So yes, the Marty bus does give away blankets, clothing, all kinds of stuff that these people might need. And you saw that under the bridge because they don't have any place to store that stuff. You know, when that winter season ends, you will see all kinds of winter wear everywhere because they don't have anywhere to store it. So, and they know that next year they'll have more will be available.
I know the locker situation that Craig mentioned it would be a really valuable asset for them to have in their daily lives.
I'm not sure where that would be housed, but it does make sense. And Open Door, I am not certain. I hear different things about Open Door, so I'm not sure how much of a resource they are.
I was just this week, a board member from Open Door reached out to me personally. They are revamping again and they are bringing back the original Open Door director, I believe. And he reached out and said, we would like to be part of the solution. So I'm just saying that they did reach out, they're revamping. And the person that's the board member has worked in this area, in this community for a very long time, which gives me, you know, good feelings that maybe this organization will be built up again and be part of this.
Part of our research, I interviewed Open Door for the research that we have in the packet. And basically their focus is on people coming out of prison when they're released from prison, and they try to set them up, jail mostly, but also sometimes from prison. And they set them up with practical items, food, clothing, and do some connection for them. But a couple times they've stepped up, like even during community on call, things like that, where they've extended their hours as they've had volunteers available. And so there's such a mix between the incarcerated and the homeless population that they end up serving both quite a bit on theirs. But that's what I learned.
Okay, probably the next slide. So Craig and I, we're just trying to think of all the nonprofits who serve the unhoused community. And Matt, you heard Matt talk about the Marathon County Deflection Team. I think that's a really great program. Only law enforcement can obviously refer to this team of people. What I think is so great is it's an incentive for people to get help that they need to overcome their addiction, so they don't have charges. I mean, that's wonderful. I don't know how many people they've served, but I know that we have a couple of clients that are working with the deflection team in our PSH program.
I think one of the excellent outcomes of the partnership between the police department, the district attorney's office, who provides the oversight for the diversion and deflection programs, is that I don't think you could find a police officer that would say, this individual with these criminal charges, whatever they might be, we would rather them go to spend time in jail or prison as opposed to receive rehabilitation and get help. Like, the ultimate goal is that these are productive, successful, thriving members of our community. And so for a portion of the population that are experiencing homelessness, the opportunity to have the police department and the district attorney's office and the access to it to evaluate that individual and say, is there rehabilitation? Are they making the right steps? And reward that with those charges being dismissed or reduced or going away. Those are conversations that occur on a regular basis, and they're able to occur because of where that program is housed. And it seems to work really well being housed at a district attorney's office, creating that partnership with us.
And in North Central, they're a partner too, right? Some of the folks at the North Central Healthcare?
I would say, yes, they're a partner in just about everything that we do. I think my understanding is the deflection program started out at North Central Healthcare and then migrated to the district attorney's office. And
Yeah, that's true historically, but currently we also work through our outpatient. We have some open spots available for the people to get in quickly for appointments. That is part of the grant.
Okay. Yeah, it's a wonderful thing. So the Wausau Police Department Community Liaison, that must be Tracy, right?
Yeah.
So everybody knows about Tracy and her good work out in the community. In the community on call coordination, she and Craig work on that along with Donna with the Neighbor's Place, right? Also very good. Now, Craig.
Yeah, this one was really surprising to me, as we had some older folks that really we couldn't care for because they were declining. We were able to connect them to ADRC. And then if they're a certain age or if they're diagnosed with a disability, ADRC then gets them to one of two companies, and probably the largest one is something that's called Inclusa. And in the interview, they were very hesitant to be sharing that we were serving unhoused people, but the reality is that a part of their caseload, many of them are unhoused. And so they've been increasingly, and they've been very successful in getting people into housing and then within housing with supportive services. But again, that's a very unique population. It's the more you got to be a certain age or you have to have a diagnosed disability.
I can speak to this. I do this work every day. So the other agency is Lakeland Care. And yeah.
Could we get that added?
Yeah, Lakeland Care.
Lakeland Care.
Yeah, I will. I work there. So yes, ADRC, this is a resource we really need to increase.
Yes.
I can't say much more, but there are, get people to the ADRC. They can screen them if they are eligible. There's a functional screen and a financial screen, of course, but that you know, I have people that are younger than 60 that have, you know, issues with something physically that happened. It could be a broken leg. It could be some kind of disease process that they have. You know, it doesn't, sometimes when you see the disability, you think of something really catastrophic, which it could be, but it could be something less, like COPD. You know, thinking things that people have, cardiac problems. But this will give them support and services within the community. Then we can pull back other resources and work with all the regular nonprofits as well, getting some community resources. You get some formal resources. There is, you know, if somebody needs housing, let's say they need a placement. We talked really early on about placements like adult family homes or CBRFs. This is where this would work in. So always keep that in mind. It is, nothing is wrong with getting somebody to ADRC to get them screened. You know, you don't have to, I don't think, let them decide because they're very good at finding a way to get people eligible for this program in family care. And so this is, and DHS is one that family care is, they like it because it's cost savings than straight Medicaid. You know, we can work them through the system instead of going to the ER every week for problems, things like that. So I hope we do really point to this because it's really a good service that could really help.
They're moving people off the streets into housing, which is kind of the idea. So, good. Yeah, so if you could, yeah, I'd say on the slide, just a ADRC/inclusive/Lakeland Care. And if we want to, yeah, that would be helpful, I think, so excellent. I think the next slide then is where we move into the gaps. And so our first observation was that really there's a lot going on for the size of our community already. There's a lot of services and we're thankful for that. But these are kind of the gaps we found. And Diane, pitch in when you want to. But the first was short-term and long-term housing for those on the fixed income. All right. And so that challenge is what really increases the unhoused population as people drop off.
Yeah, every day. I mean, we see people who can't afford where they live because, and of course, most of them are elderly and their Social Security just doesn't cover rent. I mean, a one-bedroom fair market rent is $803. You know, a 3-bedroom's almost $1,400. And if their check is $935, that's just not enough. I mean, we can point them to all the resources in the community, but it's hard for them to keep going places to get what they need, you know? So, you know, we need more lower income units and we're getting that in this community. So that's a good thing. And another big thing is those who are handicapped. I mean, they can't go on a second floor or third floor apartment building. So we really do need a lot of 1-bedroom, first level housing available with handicap accessible.
Yeah, we found that to be very true. Is it's a second floor apartment. Oh, we can't refer them. You know, so that is something. The transitional housing, that's a gap. That's what we're Commissioners working really hard at. So then obviously for those with backgrounds, whether it's evictions or criminal background, finding safe and healthy housing options, because we can find housing options for them, but we don't want to send them there.
Sometimes if we can get them housed, it might not be a good neighborhood. If we already know there's something going on in that neighborhood, we really try to keep our clients away from each other, although they do seem to find each other. But we don't like that because sometimes, well, you know how it is. If you're quitting smoking, you don't want to be around people who smoke. If you were quitting drinking, you don't want to go to a bar.
Yes.
So same thing applies in housing. You know, and probation limitations, restricting opportunity in other communities, that is a real big thing. And we're working with probation if we can. I mean, some probation agents are really great to work with, some are not. So that's just, you know, the luck of the draw. And housing and programming for people on registry, sex offenders, it's very difficult to get those housed. But I will tell you this, when we were at our former location, there was a sex offender training class every Wednesday. And those people showed up, and I would say 99% of them worked. So they're working people. And some of those offenses aren't as bad as they sound. But they don't get a break sometimes. So that's tough to see too, because I don't know. It's just hard to watch. So neutral, non-faith-based transitional housing programming and housing. At the United Way, the Housing Task Force, they identified that we need to have some neutral, non-faith-based transitional housing. And we probably do, but I'm just grateful for the transitional housing that we do have that is faith-based. It's very successful for people like Craig who run it. And I'm grateful for it. So at least we have that. The coordinated management of a system to move chronically homeless people into housing, the lacrosse model, we'd like to go there. I think that model is good. I know probably not all of it we can roll out here in Marathon County, but I think we can take some really good pieces. The housing piece is what we really need. And I think with all this new construction going on, we'll have at least 106 new affordable housing units. So that'll be good.
So just a quick observation on that housing, when you had mentioned like you get $900 and some and a 1-bedroom market rate is $800. And at least one entity that I'm aware of has purchased a property and there will be 20 or 30 units in it. And it says, okay, then a traditional market rate 1-bedroom, as much as we'd love to have everyone in that, what might be more affordable and more of the boarding house type model that I think there was a lot more of that before my time. Or at least like a Little House on the Prairie, they have a lot of that, which is, there are shared services within the building. There is a shared kitchen. There is shared bathrooms and shower facilities, but kind of like a dorm room. And market rate for those is $400 to $500 a month. And so seeing that we have some of that coming into our community, my hope is that they're very successful and that creates motivation to expand that type of business model to reach the capacity that we need it to within this community. And I would think we need more capacity of that type of affordable, much more affordable shelter housing than just 20 or 30. And I see the potential for some of those type of projects to occur here in the near future.
Yeah, I agree that is wonderful. But for somebody who's elderly, they probably would not be suited to that environment.
Yeah, I didn't see it as a solution for that, but
for a lot of others, yes.
Okay, so yeah, I'm not sure what's going to be included in the PowerPoint versus what's in the paper here, but I think this is basically my paper put on PowerPoint yeah, okay. So we can look at some bullet points for the actual PowerPoint instead of the whole paper, like Craig was saying. I would suggest that, but I just repeated the purpose here and then looked at the balanced estate continuum of care point in time in January, which showed that 13% of adults experiencing homelessness was related to domestic or other violence, 23% with mental illness, and 13% that had a substance use disorder. And of course, acknowledging that studies vary, and I think that it's understood that the need for a treatment, regardless, is an important piece of this solution. Next. And so then also Third Horizon had prepared the report for Marathon County, which was a substance use disorder gap analysis. And in that they documented our shortage of providers, like we've talked about specifically in this task force. And they talked about specifically in Marathon County that in 2024, there were 50
licensed clinical social workers. So that's a credential that can provide therapy. There are other credentials that can provide therapy, but that's common one that you will see that can do therapy independently. And that's about 30% less than in Wisconsin, which has about 30% per capita, which really shows in our area. That's why we have the lack of clinicians, and what it results in is competition for those clinicians with all of the clinics that we have and hospitals that we have looking for the same people. So then it becomes what market is the most valuable when you look at somebody with that credential. Is it a market where you have 24/7 services working with the most vulnerable people, which is what we're talking about at North Central Healthcare primarily? And so, or is it a market where you can, basically set your hours and see people with various insurance plans and can kind of select what type of people, what type of problems that you're working with? That's really up to people who are credentialed what they want to have, but it has really created a lot of competition for us to be able to have providers. And obviously, a lack of providers then translate to a lack of programming in general. When we look at the programming that North Central Healthcare provides as being the behavioral health provider for Marathon County, our services are largely funded by Medicaid. We receive some commercial insurance and some Medicare in our outpatient clinic, but Medicaid is our largest payer source. And that's really important. And then I just want to also mention, I didn't name other community treatment organizations because I didn't really want to leave anybody out. I'm not really sure what all their payer mixes are, but various ones have different payer mixes. Some are very heavy with commercial insurance, and so they would rely less on Medicaid than North Central Healthcare would, for example. But those who treat the most vulnerable populations also may have financial support from community funders such as United Way or others to provide for those who are underserved. But no matter what target population you're serving, we're all competing for the same clinicians. Next. So what that means is, again, lack of available treatment programs. We are looking at, all right, I feel like this is kind of repetitive here now when I'm reading this, right? But, okay. What this is saying is that for us to look at current funding is a barrier for us to expand services. So we have a continuum of treatment services that we'll review, I think, on one of the upcoming slides. However, to look at maximum access and increasing that, we have to look at funding sources. One of the current concerns are, in addition to Medicaid not always being the most what do I want to say? The reimbursement rate isn't as high as commercial insurance in many aspects. There's also some federal initiatives that you may be aware of looking at additional Medicaid cuts for various programs, including rural hospitals, with which North Central Healthcare would be defined as a rural hospital. So what I think the concern is that potentially watching what may happen with Medicaid, things may become worse in terms of what services are available to our most vulnerable populations instead of better. So that's just something for us to think about when we're looking at also we want to expand services. All right, next. And then this is just a summary of the various services that are available in our community, either through North Central Healthcare or other area clinics. Community treatment, this is North Central Healthcare. Specifically, we're certified for Marathon County to be that agency to do case management for individuals in recovery, which is substance use and mental health in the community. Then there are, of course, various outpatient clinics for therapy and psychiatry in our area that provide individual and group treatment options, including peer support. We do have peer support and recovery coach services available. Our 28-day residential recovery program is available.
crisis stabilization facilities, and then our crisis response team and 24-hour crisis services, as well as our behavioral health hospitals. So when you look at this list, it's really quite impressive what we have available in our community through North Central Healthcare and our partners. And we still don't have all of the clinicians that we need to operate all our programs necessarily at the fullest capacity and to be able to get people in on the most timeliest fashion. Yeah.
I think somewhere on this slide to be able to indicate, because I think we spent a lot of time talking about it, that as I look at that list, I see one that is not necessarily voluntary. And to identify, like, because sometimes crisis stabilization, like if they're under a Chapter 51 hold for a period of time for stabilization, like that might not be voluntary, but medically monitored treatment and community treatment, like that requires active participation and a willingness to be there. And I think that might be a clarifying point that's worthwhile for our audience. Just a suggestion.
Sure, absolutely. The only one on here that is not voluntary would be our behavioral health hospital sometimes when you're under detention. And about 50% of our admissions are under an emergency detention, which means it's not voluntary. About 50% are voluntary. So even in that category, there's still a mix. But that's a great point, because even in the crisis stabilization facilities, it's still voluntary. Okay. So I wanted to talk then about what is our path forward when we look at treatment services. So we've talked a lot about this in our discussions and also at the United Way homeless task force, is that everybody has their own story and therefore their own path forward. It doesn't look the same for everybody. And I think we have to resist that there is one solution for every single person. We have to really understand, first of all, what the needs are for those people. So in order for us to figure out what we need specifically when we look at that gap analysis and how we move forward, we need to understand what the current population is who's homeless, what their status is of needing services. And if you recall, when we had the presentation from La Crosse, that was one of the things that I was so impressed with, is their assessment process that they used. I'm not sure what tool they use, but with their collaborative team that they have, they're doing an assessment of people to determine what level of support, case management, and treatment that they might require. And some people will be at the end of needing, even potentially inpatient, all the way to somebody checking in on them, once a week or once a month, and they don't need mental health or substance use counseling. So there's the whole continuum. And so until we know what people we're talking about, I think it's very difficult for us to say, how would we mobilize new services? So if we make the assumption we get to that point where we really understand who it is we're serving, what services they need, I'm confident we could meet some people's needs in the community with the services that we have right now, when they're at the point of being ready for service. So some of that goes back to all those other things we talked about, that they are stabilized. Chief, you talked last time about Maslow's hierarchy of needs, that they have the other things in their life. They know where they're going to put their head at night. They know where they're going to have their next meal. They're ready to engage in some level of treatment at that point. And so then we can look at what is it that they need. If we have 5 people, we can serve 5 people in our community, right? If we have 200 that need service, that's an issue. Then we need to look at what types of services they need and where we could then develop additional resources. So really, to me, before we can have a definitive answer about what we need to know what we're really trying to address there. So that's really what this slide is saying. And at the end of the day, it is really a collaborative response for us to be successful. And that's going to be, I think, contingent on some new resources once those are identified, and our support of all the community partners to continue as it is with helping people to avail those services as well. And we even included at the end of here transportation, for example, to actually get to services that they may need. All right. So I think, I see. So the slide I saw before is not going to be there. This one will be here. Is that?
We can do that.
Okay. Because otherwise it feels like this is repetitive somehow, right?
Yeah, I think what the asterisks are up there is for the bullet points of those important those three important things that you were speaking about in the previous slides.
Okay. All right, if I could take a look at this, is that there's probably what you're gonna ask us to do, that we could take a look at this and determine what should be in the slide versus what should be in the paper
Right.
that would link
Yeah,
to?
and just
Okay,
email me or let me know and
Okay.
copy Becky on it too, and
Yeah.
we'll.
because I'd like this last sentence here is that effective treatment plans, programs, engage people at their optimal level of readiness and recognize that life-changing success comes from a comprehensive approach to support people in their recovery journey. I mean, I think that's really the meat of it.
I think that makes a lot of sense. Absolutely. Yeah, nice job. When we look at our charter, we had a short-term goal, and the short-term goal was, out of the picture right away, when Annabelle apartments have been sold. So go on, go to the next slide, please. So our intermediate goal, within 45 days is provide recommendations to City of Wausau, Marathon County as to whether the demographic data gathered necessitates the development of formal mechanism to engage surrounding municipalities relative to resource sharing. And the motion was approved to direct the county administrator to work with city to engage surrounding communities. And a report is forthcoming. Next slide, please. So in the administrator's work plan that went through the county board was to confer with local municipalities and other stakeholders to evaluate opportunities to aid in improving service delivery to unhoused persons, including community on-call system. And you can see the bullet points that the administrator put in his work plan in this slide, working with all those different participants. So our current point in time for 90-day, which we're at our April 1st, coming up to our April 1st deadline, is to provide recommendations relative to the specific roles of other local municipalities, particularly those surrounding municipalities. And that's one thing that I believe that Administrator Leonard has in his work plan as well. And then to identify gaps, which we did in this presentation. And then engagement of the business community and explore opportunities for businesses to contribute resources, expertise, and support to homeless initiatives. And then the business member, the one business member that we had on the task force declined membership, as we determined after our first meeting. Next slide, please. So long-term goal, and I like what Bill had put together for some of the things that he had sent me. If you want to speak to this one.
Yeah, I'm not a business guy, but I'm a business guy too. So, yeah, those points I pulled from the homelessness conference that was in Green Bay, and a lot of the people that were saying what was successful in their areas, so that not, this is the balance of state folks, so not Milwaukee, not Madison, but like Sheboygan, Appleton, Green Bay, and La Crosse, part of that too, is giving area businesses ownership and the ability to be empowered to be part of the solution without just giving money, because that's generally when you think of the business community, they're going to give money. Like, no, we don't have to have them give money. A lot of places where homeless folks either congregate or are often at can be points of contact where social workers can be stationed, or that they can be connected to services. So, and the contractor network, I thought that was an interesting one. I forget what that was from, but they had rapid repair for landlords as a service because that population does occasionally wreck a few apartments, and having the ability to have, businesses like contractors or businesses be able to be on call for that such eventuality would be helpful for landlords to rent to that population.
Okay, thank you, Bill. And that's the, how do we engage the business community goal, right? So thank you. Next slide. So leveraging the business points of contact, Bill, if you want to talk a little bit about this one too.
Yeah, that's just, the places where you see them, where they are, if you remember, Mr. Olson, the reason he wanted to be on it, because he had homeless folks outside his store, and he wanted them gone. Well, you can get them connected to services. That gets them gone, and it helps them at the same time. So that's the impetus for that.
Okay.
Oh, yeah. And then I know like Crystal Finishing already goes to the shelter, and Northern Valley obviously does too. But having employment opportunities for people that are ready for it, that just removes another barrier. If you go to them versus having the other way around.
Right. Okay. Next slide, please. So communication and community cooperation, and I think, Bill, that you had touched on this one as well. Hold a series of facilitated conversations between local employers, landlords, representatives to discuss solutions to the housing stability issues employees in Marathon County face. And we talked a little bit about that in earlier slides. I think Diane talked a little bit about that as well. Ensure all school and hospital social workers are connected to the housing and homeless systems and understand the resources that are available for children, youth, and adults. And I think that there possibly might be some programs already in those places that, when maybe a school will identify somebody that might need some services, they already put those actions into place, if I'm not mistaken, right? Okay, next slide, please. So support from nonprofits, faith-based organizations, the report that were listed in the previous slides were excellent. You can see that there's a lot of support from local nonprofits and faith-based organizations, a lot of support. So the short term in the resolution that was passed recently for funding of homeless shelter services, I don't think we need to touch on that too much because it already passed overwhelmingly to work with the city to support those services. And then identify opportunities to maximize the effectiveness of the initiatives and enhance comprehensive support for those in need. And the Pathways Home presentation from La Crosse addresses that and how we can do that. My recommendation on the slide here is to direct the county administrator to work with city staff to develop a long-term plan to address a goal of a net zero homeless population by the end of the first quarter of 2026. If that makes sense to you, because our direction on the task force is to come up with recommendations to the county and the city on that partnership and developing a program. It's not up to us to develop the program. It's up to us to recommend that those two entities work together to develop a program.
So if I'm understanding that correctly, which I think I am, if at some point leadership, I would imagine, in the city of La Crosse and in the La Crosse County said, staff and nonprofits and everyone come up with a plan. And that is what we see in Pathways Home that was presented to us. So your recommendation that's articulated here for policymakers is to give direction to city and county staff to facilitate that so that the end product is, here is our plan and a timeline for completing that plan.
Correct. Okay. I think that's the last slide, right? Yep. So, we have discussion and possible action here on the final report. And if we want to make a motion today, I believe because it's under the possible action section, that we can make a motion to, if you want to go to the previous slide, we can make that recommendation to direct the county administrator to work with the city of Wausau staff.
Can I ask a question?
Sure.
So, and then to your point, so the plan is due by the first quarter of 2026. Okay.
No, I looked at that date too. Really?
It's almost sounded like the population would be by the end of 2026, but you mean the plan would be due. I'm wondering if we could add a few more words instead of just a long-term plan.
Sure.
Because I think everything we've been talking about is that it's a coordinated strategic actionable plan. Otherwise, we're gonna get, I shouldn't say that, I don't mean that disrespect to any leaders, of the county or the city, but what I mean is when we talk historically, what we've gotten when we have these kinds of task force is a great report that doesn't go anywhere. So I think that part about it being actionable and coordinated would be really helpful so that we know that there's accountability for it to actually occur. So we use all of our time for something helpful.
No, I like that. And just because words matter, and I think I know what it says. It says address a goal of a net zero homeless population by the end of first. So is what I'm suspecting that I'll be part of whatever the city staff is that does this, is what we're looking for a program that results in a functional zero. So people are leaving homelessness at the same rate that they're entering, and now we have a manageable population.
Yes.
I'm just not sure the average citizen sees net zero and sees it as like, oh, there's no homeless.
Yeah, and I think I got that from the lacrosse model, when they talked about net zero, population.
It's gotta be defined.
Yeah.
It's gotta be defined.
In my world, because at one point Marathon County was at a zero functional zero homeless family situation. I like the word functional because
Okay.
that's the word we use in our world. Because it's like Matt said, it's never going to be zero, but it's gonna be where we can manage the flow in and out. Because life is always moving. There's
Okay.
always stuff going on in people's lives. So I like functional better. Sorry.
So if we say develop a long-term plan to address a goal of functional zero homeless population.
Yes.
Yes.
And then I think you need a slide in the presentation that defines functional zero,
Right.
With imagery.
just so that everyone understands.
Yeah.
Yeah.
Too many.
Well,
words.
because-
Zero.
Yeah.
That's.
Yes. Is it appropriate to ask when will this report be made?
And then ask what?
When will this report be, made? Since it sounds like we're all participating in the presenting the report, when is the report going to be made?
We can put something in there about, I'm just trying to think of how it would go through committee.
I meant this report that just went through.
Oh, when would it be presented?
Yes.
So that's one thing that I'll have to talk to Administrator Leonard and Chair Gibbs and probably the city to see.
So that's still to
And
be determined.
Vicky kind of talked to me a little bit before the meeting about, hey, would it be possible to do a joint city Marathon County meeting and just have us maybe, sitting up here and presenting the information to both entities, which I thought was a great idea. It would, and then we wouldn't have to go through presentations 2 times, right?
Well, and I would just recommend whatever the process would be to skip the committee process of presenting to a committee and then having it continue to jump from committee to committee, ultimately to the whole. So I don't know what it's called at the county level, but my thought on this educational presentation, decisions can be made by committees and the whole, but we call it a committee of the whole, which is where no decisions are being made. It's where information's presented.
We have an educational session. So, every Thursday typically before the Tuesday meeting is educational. So, we would do, and my thought was that we would do an educational presentation. Bill and I could take if we do a motion, as stated in the last paragraph, we could bring that to the Health and Human Services Committee, through that committee to the full board, because typically any motions like this would have to go through committee level before it goes to our full board.
But the task force was formed, so we bring back the report to the board.
Right.
So it would bypass all the committee.
And that would be this
This one right here.
presentation
Yeah.
to the full board. Yep.
And we have done a city-county meeting before, so it's not.
And my motivation for that is I truly believe that in order to inspire our elected policymakers the totality of our group that has spent time doing this, being there representing not only the organizations we work with, the boards you're on, the departments, that speaks more volumes, but the idea of getting us all together at multiple meetings at different times is just more challenging. So
Right.
to be able to deliver a very effective presentation where we're endorsing it and that's why we're put there, I think that has more value.
I think you're spot on, and you know, I like Vicky's idea of bringing everybody together and doing it all at once. I think that brings a lot of value. Okay. Somebody want to make a motion?
I'll make that motion.
Okay, we have a motion to direct the county administrator to work with Wausau city staff to develop a long-term plan to address a goal of functional zero homeless population by the end of first quarter 2026. Do we have a second? We have a second by Bill Conway. Any further discussion?
I was just going to clarify, you were going to add the words that we said before, the actionable. I forgot already my other word, coordinated.
Yeah, develop an actionable coordinated long-term plan.
So, yeah, we can, since we have a second already, we can add an amendment to the motion. So, can you walk me through what we have and where you would like that to put that in that? motion?
It says to develop a long-term coordinated actionable plan.
I don't want to throw too many words in there, but I think this one's important and it's measurable. Like, and included in measurable is you're going to have to be collecting data that supports whether the plan is successful. So I would recommend the word measurable as well.
Well, to address a measurable goal, right, of functional.
Sure.
Yeah.
So,
Address a measurable goal of functional zero.
well, not necessarily
No, it's
actionable,
no,
long-term
that
actionable.
it's fine.
We want to say to develop a oops, sorry. We want to say to develop a long-term actionable,
Coordinated actionable.
coordinated, actionable plan.
So coordinated first.
Yes. To address a measurable goal of functional zero homeless population by the end of first quarter.
Okay.
Just, I'm sorry to make this difficult, but again, by the end of first quarter is saying functional zero homeless population by the end of the first quarter. So maybe you need to put end of first quarter earlier. So to work with the Wausau city staff, comma, by the end of first quarter
Will develop.
to develop a plan. Just move that first quarter away from the functional zero. I'm so sorry.
And everything.
No, it's okay. So you want to move first quarter from the end to where?
Right now, it's the subject of that
Yeah.
sentence, so you
Yeah.
have to bump it up.
Yeah.
Otherwise, you're gonna want functional zero by the end of the first quarter.
Right.
That's not what we're asking.
We want the
We
plan.
want
by
the plan, the plan at the end of first quarter.
So-
It's functional zero.
So I've got to develop a long-term coordinated actionable plan.
By the end of first quarter.
To develop.
Yeah.
By end of Q1
Right,
2026.
right.
Then to address. And you'll have to throw some
Goal
commas
of
in
a
there.
functional zero homelessness.
Yeah, a measurable
population.
goal. To address a
So
measurable.
instead of functional?
No, it's up there. So
Oh.
address a measurable goal of functional homeless.
Address a measurable. Okay.
I think because this is getting delivered to both the city council and then you need a whole nother bullet point, or you need to find ways to add more words to that, which is a recommendation to the city council to direct the mayor to assign city staff to work. Like if we're gonna have this recommendation of the county board to direct that this gets done, like that would, if that's not a decision that the city council's making, the city could just say, nah, not interested, right? So to get policy bodies to direct both staff from both the county and the city to participate in that.
So two separate motions, one to the county, one to the city.
Yeah.
Right, because they're not gonna vote as one entity.
Yes.
Give me a minute here. Okay, right now, I've got, direct the county administrator to work with the Wausau city staff to develop a long-term coordinated achievable plan by the end of the Q1 2026 to address a measurable goal of a functional zero homelessness population.
Like it.
That's the amended motion.
And then are we gonna have a second one with that exact same verbiage, city council to mayor? So we'll have two recommendations essentially, one to the county, one to the city.
Sure.
So Vicky, you read,
Well, he just read it, I
right?
think, right?
Yep. And then where's the city Wausau?
Oh, and then you just flip it, you just switch it to put.
And then the other one would be direct the
Okay, city mayor to, or the-
city, who,
I don't know, direct city staff to.
city staff.
To work with,
county
direct city staff to
administrator.
work with, yeah, county administrator.
Okay. And if you want to work on that one,
Yeah.
I'll send this one out.
I'll write that, yeah.
Okay, so we have a amendment on the table. Is there a second to the amendment? We have a second by Bill. Any discussion on the amended motion? All in favor? Aye. Opposed? So the amendment to the motion passed. Now we have to vote on the motion as amended. All in favor? Opposed? So the motion passes as amended. So thank you. We'll bring that to let's see, probably Lance or Chair Gibbs. And then see how they want to route that. All right, I believe that's all we have on the agenda. We do have a meeting scheduled for next Monday to finalize everything. If you think we still need one, or we can, if you think we just accomplished everything today, then we can cancel that one.
I don't have our agenda in front of me, but were we, I might be imagining things, weren't we going to, didn't we postpone a vote until this
No, we
meeting?
did it already.
Okay, sorry. That's what happens. That's what happens when you're late.
On the attic support letter.
Okay, very good.
Voted it down, I know, it's weird.
Yeah, I think the only thing is, should we then kind of plan to do the report similar to how we did it here?
Yes,
And then Diana, you and I can kind of decide who's gonna do what bullet points. So is that it's gonna flow just like you did there?
yeah, and if Chief Barnes would be so kind to have his guru maybe flow that into the PowerPoint of the city below it, because I'd like to do the history first, like that you
Yeah.
have presented, and then flow the rest of the presentation into that.
And then, you know, this just maybe the kindergartner in me, but I am a fan of visual in the PowerPoint. And so I got a guy, so I'll be like, go take a picture of the CPC, go take a
Yes.
picture of where the shelter is, and we can add some visual. Like if we're going to talk about North Central, let's show a picture of what North Central looks like.
Well,
And
we have the pictures we can send you.
Yeah.
that would be great. And so,
And Vicky, were you also gonna reduce
Yes.
to what your bullet points are, similar to like, yeah, and with a link then if you want more information,
Correct.
just so this doesn't become overwhelming with content.
Right,
Right.
right.
And maybe
That's why you
space
see some of
things
the
out.
grayed out ones. I
Like
didn't
I
have.
really like the one that Becky presented from. There was more slides, but they were spaced out. It wasn't overwhelming. So I would like if the whole presentation could be similar
that
to
too.
that.
Yeah, if you have a guy, that would be awesome.
And I'm going to just recommend, I don't know if there's a clear purpose why we should meet on Monday. So I would think if we could repurpose that time, then we could work on what we need to do for follow-up and get that to you by a certain date that you will name next week
Sure.
or.
So the only reason we did it on Monday because our charter ends on Tuesday. So
Okay.
just in case we needed any follow-up actions after today's meeting. So if you don't think we need to meet on Monday, we can repurpose that time to do
I
the
just think we need time to
presentation.
do
And then
our.
I'll work with
revision.
Chair Gibbs and Administrator Leonard to find out how we can present this to both entities. That work? I appreciate everybody's work in this. I mean, this is phenomenal. And like I said at the first meeting, I think we can move mountains. And I think we're getting there. I think we're doing a great job. We've got a lot of support from the county board, city, council, and I think we're moving in the right direction. We're actually, I think we're gonna move the needle, you know, after how many years, right? So great job, everybody. I really appreciate it. Do we have a motion to adjourn? Motion by Vicky, second by Diane. All in favor? Aye, opposed? We are adjourned. Thank you very much.